Most injured workers think that having surgery will automatically make their workers' compensation case stronger and more valuable, but it's not always true. In fact, surgery can sometimes lower the value of your case, delay your benefits, or get denied altogether if it's not handled the right way. Today, we're going to break down 4 ugly truths about workers' compensation, surgery, so you know exactly what to expect and how to protect yourselves. Surgery doesn't always mean more money in a workers' compensation case. Workers' compensation doesn't cover pain and suffering, so more surgery doesn't automatically mean more money. You got to understand the difference between workers' compensation and a personal injury case, where pain and suffering has value in a personal injury case, is compensable, awardable, payable. It has no value in a workers' compensation case. And people think that, well, if I go and get my second or third or fourth surgery, whether I need it or not, I think you're crazy. But they think the pain and suffering that they go through is going to get them more money. And it's just not true, because there's no money for pain and suffering in workers' compensation. The value of a workers' compensation case is based upon your level of permanent disability. Surgery is supposed to make you better. Whatever your condition is, whatever your level of disability is before surgery, theoretically, having surgery is going to improve your condition, which lowers your disability rating, which could lower the value. So, it's a two-sided coin there. The need for future surgery can increase your settlement value. So we talk about surgeries that usually require revisions or second surgeries. Knee replacements generally need revisions 10 or 15 years down the road. Spinal cord stimulators generally need battery changes 10 years down the road. Hardware implantation surgeries oftentimes require hardware removal surgery. Hardware goes in, hardware sometimes has to come out. So those surgeries that are presumably needed down the road could increase the value of a case and settlement value overall. When you're recovering from your surgery, you usually get temporary total benefits. So usually when you have surgery, your benefits get bumped back up to the total rate of compensation, which is 2/3 of your average weekly wage, up to that statutory maximum figure that we've discussed. But as time goes on and your condition improves, that money will go down. Your benefits may be interrupted if you weren't attached to the labor market before your surgery. So you were found to have a partial disability and the insurance company raised the issue of labor market attachment. You were instructed by the judge before a work search. And if you didn't do a valid, sufficient work search, then there's a strong possibility that a judge finds that you are not attached to the labor market. And if you go and have surgery, even though you're presumed to be totally disabled, if you're not attached to the labor market, you're not going to get money for that. It limits your money. Surgery can delay your workers' compensation case instead of speeding it up. You're assessed for a schedule loss finding usually a year after your date of accident, unless you have surgery. And that resets the clock, and now it's a year from your surgery. Why? Because you were total following your accident, you got a little bit better. Surgery, you're total again. So it restarts the clock, and it could drag your case on for a longer amount of time. Doctors usually wait about a year post-surgery to assess for maximum medical improvement. Usually it could be longer, 2 years in the non-schedule realm. We start looking at settlements generally around that NMI time, as you're approaching maximum medical improvement, as you're getting close to the point where we're going to start looking to finalize your case. So in many circumstances, restarting that clock restarts that settlement clock as well. And again, every case is different. Surgeries come with risks. Sometimes there are complications that prolong the process. You need additional physical therapy. Your pain level is higher than most people, and you need prescriptions for a longer period of time. Could be any of 1,000 different things that a doctor might need you to do in your particular case that most people don't have to do. These risks are something that you need to consider. If complications come up, workers' compensation should cover them. And if you settle your case before or during, then they're not going to. And this includes the follow-up care, rehab, and any possible complications that come along while you're recovering from a surgery. I often advise against settling a case when surgery's on the table. And, some people say, give me the value of the surgery, have them give me the money, and I'll go do the surgery on my own. I'll pay for it when I feel like it. In theory, it sounds like a decent move, but you never know. Maybe your physical therapy didn't go great and you need extra physical therapy. You're going to have to pay for it. Maybe you need more prescriptions. You're going to have to pay for it. Well, you're kind of screwed. So it's a very big deal. And, the same thing happens when people say, well, let me go get my surgery right now, and then we can settle right after. Well, that's not always the case for the exact same reason. I want to let you heal and reach, some threshold of well-being before we go and settle the case. And rushing to settle the case is not always the best idea. So you want to make sure you're covered and you've reached some level, some plateau where you're in a safe place, you've healed enough, and you can safely move on with the settlement of your case. Getting surgery approved in your workers' compensation depends on the right doctor. In New York State, you could choose your own doctor, so you got to make sure you pick one that knows the system, one that is workers' comp coded, one that understands the PAR process, how to request a surgery, how to follow up when it's denied, how to submit the proper documentation, how to get your surgery authorized. Doctors have to follow the medical treatment guidelines. The medical treatment guidelines require some level of conservative care, some course of physical therapy. I'm speaking very generally, of course, but they can't just jump in and request surgery unless they have a really, really good reason and it's documented well. The insurance companies will often deny surgery, citing pre-existing conditions. Lack of conservative care is a big one, or missing documentation of improvement. These are all things that need to be provided when a doctor is requesting authorization. And when they deny it, the insurance companies must state the reason for the denial. And then the burden shifts back to the doctor on pushing that request forward and satisfying saying that denial? Well, you're saying we didn't do enough conservative care. Here's our records that show we did 18 visits of physical therapy, which was per the guidelines. The guidelines say for this XYZ injury, you do 18 visits of physical therapy, and if that doesn't work, you request an MRI and you do surgery. Well, here you go. The doctors have to provide thorough documentation of treatment and progress. So you got to make sure the doctor knows what they're doing and knows how to address those requests and those denials so that you can get what you need, get better, move on with your life, because that's really the goal here. Truth number 4, you still have options if surgery is denied or if you don't want it. Nobody can force you to have surgery. We've had many clients who are deathly afraid of having surgery. We've had clients that have religious objections to having surgery. We've had clients that just say, I don't want to do it. Whatever the reason is, you don't have to have surgery if you don't want to, and that's totally fine. People decline surgery due to a lot of different reasons. Nobody can force you to go forward with surgery, and your case can still be settled without surgery. It might lower the value, and it might increase the value. It might lower the value because, your injury might be deemed less serious because it didn't require surgery, even though it's requested, but it's not being done. It might increase the value. We could say, hey, this person clearly needs surgery. They're just choosing not to do it right now because they have 2 young kids and it's not the right time for them. Let's settle the case. Let's put a little more money into it. And maybe that can get you a little more settlement value and you'll deal with your own surgery when the time is right. Every case is different. If your surgery is denied, remember, denials are not final. Your doctor can resubmit with better documentation. If they're denied, you may be able to settle now and still reopen your case later if surgery becomes necessary. This is why it's so important to work with an attorney who knows what they're doing so they can get you to that end result that you want and you need so that you can preserve, maintain, and maximize your benefits. If you're having trouble finding a lawyer, please feel free to call me, 212-406-8989. Hit the like on the way out. If you have questions, please put them up in the comments and I will do everything I can to get all those questions. I'll see you guys. Be safe. Bye-bye.